Hi, this is Michelle Walker, and we're going to be doing a cold application checkoff today. And I'm also going to be going over a quick heat application as well. But we have orders today for a cold application on a 22-year-old male. So I'm first going to go through COWIP, which is check your orders and check the allergies of the patient. You're going to assemble any necessary equipment and assess your patient. You want to wash your hands, you want to identify yourself to the patient and identify your patient with 2 identifiers. You're going to provide for privacy, and you're going to educate, explain, and evaluate your patient. So our orders are for a 22-year-old male who's playing basketball, strained his left ankle. So he's coming in for that left ankle strain. So I'm going to, upon assessing him, we're going to check for capillary refill, kind of do a neurovascular check, look for any swelling, and we're going to measure that, any bruising, discoloration around the ankle. We're also going to be checking the pedal pulses, making sure that he's got strong pulses in his limb, making sure that there's no impact on his blood flow and his circulation. We also have an order not only doing a cold application every 4 hours for 2 days, but we have an order for ibuprofen ibuprofen every 4 hours as needed. And for the ibuprofen here, I have my med sheet. And it is an NSAID, so we always worry about with NSAIDs, common adverse reaction would be like a GI bleed. We look for nephrotoxicity. So we're going to be running, before I administer it, we're going to be running hepatic studies and kidney function tests to make sure both kidney and liver's function is good. Before we administer that, you want to administer it with food for NSAIDs because it can be harsh on the stomach. And some common side effects you want to educate your patient on before taking ibuprofen is the headache, dizziness, nausea, vomiting, tachycardia or a rash also can be a common side effect. So just look out for those and make sure that the patient communicates if he's having any of those side effects. So I'm going to go ahead and administer that to the patient, and we're going to go ahead and get him in position. We're going to go ahead and raise the left ankle here with a pillow. So I went ahead and assembled all my equipment. If there's any cords that you're using for your cold application, make sure you inspect that and there's no damage to them. You want to glove yourself, and then you want to put a barrier in between the cold application as well. So I'm going to get a towel. And that's just to protect the skin. When you do cold and heat application for both, you want to do this, and then you want to secure the cold application on the site. Let's see, we're going to go down here actually, right here. All right, so you want to secure it on there, and the application is going to go on for 20 minutes, but you're going to check the skin every 5 minutes to make sure that there's no damage to the skin due to the cold application. You would do the same thing for heat application. And at the end of 20 minutes, you don't want to go any longer. At the end of the 20 minutes, you want to change the bedding, any dirty linens, and you also want to inspect the integrity of the skin. Make sure there's no damage. You want to document it, and you want to make sure that the patient is comfortable, make sure the patient has a call light within reach before you leave, and then you want to document your application and the skin site, and then also how well the patient tolerated it if there was any complications. And that is it for cold application checkoff. Thank you.